like to invite our eminent speakers. First, I'd like to introduce Professor Dr. Kiran Guleria. Please, ma'am. Dr. Guleria is heading the Department of Obstetric and Gynecology at UCMS GTB Hospital, Delhi. She is holding many important positions. She is chairperson of Multidisciplinary Committee, AOGD, 22 to 24, Vice President of AOGD from 2017 to 18, Honorary Secretary NARCHI Delhi from 14 to 16, and Organizing Secretary of FOGSI BOH 2017 Conference, member organizing team of several AOGD and NARCHI conference and workshops, and joint organizing secretary of 51st AICOG. She has won many awards and recognitions. She has received International Session Award in Tokyo, Japan in 2002, Young Scientist Award AOFOG at Seoul, South Korea in 2005, Korean National FOGSI Award in 2011 in the senior category, 8 Postgraduates Award FOGSI RD Pandit Award, DMA Chikitsa Ratna Award in 2019, ICOG Dr. Usha Saraiya Oration Award in 2019, FOGSI Dr. Rajat Rai Award in Fetal Medicine in 2020, and she has more than 190 publications in various national and international journals. Let's give her a big round of applause. The next speaker is Dr. Nisha Kapoor, Director and HOD of Ops Gynecology from Marengo QRG Hospital, Faridabad. Dr. Kapoor is a renowned obstetric and laparoscopic gynecologist with more than 30 years of experience in handling high-risk pregnancy cases, cesarean deliveries, and advanced gynecological laparoscopic surgery. She has been a DNB teacher for 13 years. She is a life member of many professional bodies like FOGSI, IMA, AOGD, DGES, IMS, and executive member of FOGSI Reproductive Endocrinology Committee. She is also holding the prestigious post of President of Faridabad Ops and Gynae Society. She has a national faculty in various conferences in India and abroad and has many publications to her credit. Let's give her a big round of applause. Dr. Tripti will introduce the next speaker.
Good afternoon, everyone. I'll take the opportunity to introduce Dr. Professor Meenu Walia. She's Senior Director and HOD Medical Oncology at Max Institute of Cancer Center, Pattaparganj, Vaishali and Noida. Dr. Meenu Walia is a medical oncologist at Pattaparganj, Delhi, and has an experience of 29 years in this field. Dr. Meenu Walia practices at Max Super Specialty Hospital at Pattaparganj, Delhi, Max Super Specialty Hospital in Vaishali, Ghaziabad, and Max Multi Specialty Center in Sector 19, Noida. She completed her MBBS from GB Pant Hospital, Maulana Azad Medical College, New Delhi in 1993, MD General Medicine from PGMIR and Dr. Ram Manohar Lohia Hospital, New Delhi in 1997. And DNB Medical Oncology from National Board of Examinations in 2005. Am I audible? She's a member of American Society of Clinical Oncologists, member of European Society of Medical Oncology, member of UICC, affiliated to Indian Medical Association, life member of Association of Physicians of India, affiliated to Delhi Medical Council, life member of API Delhi State Chapter, and life member of Indian Academy and Clinical Medicine. Some of the services provided by the doctor are giant cell tumor treatment, hematological cancer, stem cell transplantation, sinonasal malignancies, and external beam radiation for prostate cancer, etc. Please give a big round of applause for that. I'd like to introduce Dr. Jaya Shukl, who's a fourth panelist. She's clinical psychologist at Marengo QRG Hospital, Faridabad. Dr. Jaya Shukl is a PhD research scholar with MPhil MA, EA degree. She deals with patients of depression, anxiety, thought disorders, psychosomatic disorders. She specializes in psychometric assessments. Also, she is an expert in providing marital counseling and family therapy. She is a co-founder of ProGAT, India's first clinical career counseling initiative. She is a consultant psychologist with several other hospitals and has her own practice. Currently, she is handling Campus drug de-addiction and is running a clinic under Bhagirath Seva Sansthan. She has also been appointed as jail counselor with Dasna Central Prison, where she dedicated herself to improve the mental health prison inmates. She is an international researcher. She has presented and published her research paper in many international journals. She is also an expert columnist with TOI and Hindustan Times. Please give a round of applause for her.
Now let's start our panel discussion on caring for women's health in different decades of life. A woman is the pivot of the universe, and the woman is an axle around whom not only the family revolves or the society, but the whole universe revolves. Her health is of utmost importance in all stages of her life. Whether it be her childhood, puberty, pregnancy, menopause.
So as we have we all experience and we all know about this, what a woman has to undergo throughout her lifetime course. So there are so many things to deal with, multiple roles, especially once she becomes the breadwinner of the family. Besides the normal household chores, the routine ordeals, she has stepped into the outside world and has to fight for her place, her position in society. So there is required to be a balance between especially two diverse roles. After that, once she crosses the Lakshman Rekha of the home. There are various periods in her life where she has to undergo not only physical turmoils and the mental turmoils, and that is also related to her body changes because of the hormonal changes comes into role play. So many things to handle.
For a doctor and a health institution, let's empower women by helping them with being aware of their health as well as women's health. I request Dr. Guleria to please give us few inputs on as to what are the women's health aspects which needs attention.
So thank you very much, and very good morning to all of you. And at the outset, I would like to thank Dr. Kamla and the organizers of this conference and this session for having invited me to this August gathering. Actually, for me, it's like a new experience interacting with you all, because most of the time I am basically involved in the clinical part of treating patients only. I think as far as the women and working women, as you specifically have asked, there are two things about it. One is that biologically, we as women, our components are such that we just being women, we become more predisposed to certain diseases which are specific to women. And second, if you are a working woman, you are an institution in yourself. Because, you have so many responsibilities. One is a professional, which you are working, say, 8 to 10 hours. Many times it creeps into your domestic life also. You are all many times thinking about your professional or trying to finish your professional work even during that time. But yes, you have a professional time. You have a domestic time. You have so many roles to play, as you have already said, as a wife, as a mother, as a daughter-in-law, and so many other things. And then you also have a personal life, you also have a social life. And then how do you kind of do justice to all of these? So you have to juggle really between these roles, which can actually add a lot of stress into your life. Because you want to do everything you want to be 100% perfect in everything. I want to be best in my profession, I want to be best at my house, best in my relationship, also want to have a very good social life. So what am I a superwoman? And in a kind of attempt to become a superwoman, you tend to kind of put your own health issues at the last in your priority list, and that is what you become prone to certain issues of the working woman, you can say, which are important. So many of these are related to your stress at the job. But I would like to kind of categorize them differently. First, the physical health issues, which are specific to you. They can be general health issues, and secondly, they can be issues which are specific to women because you have a reproductive system, you have hormones. So those are the issues which are specific to you. As far as your general health issues are concerned, they are, since you are a working woman and there are changes in your lifestyle, many of us are only working while sitting. And so we have long sitting hours. So there are lifestyle diseases which are creeping up much earlier in our women these days as compared to earlier time when we were more physically engaged. So this could be the early onset of obesity. We see a lot of it in our working women. Then there could be the disorders which are associated with it. This could be hypertension, early onset. There could be type 2 diabetes, which happens early. You have cardiovascular. Okay. Hello, is it better? Okay. So you have these issues like general issues of, then there are certain issues like autoimmune diseases which are more common in women, thyroid disorders, arthritis. Then you being at the workplace, your posture, so you also have some musculoskeletal problems, chronic backaches. You have these chronic fatigue syndromes where you are almost like it's a burnout for you. And so these are the issues which are general issues, general health issues. But then there are some specific issues to a working woman as far as she is a woman. So one of them is like delaying your marriage. So nowadays, because you are so focused on your career, you tend to delay your marriage. So you have issues of infertility coming in because it's a late age. There are, your ovarian reserves are going down, so you have problems with conception, so you will have issues of infertility. Your requirement for going to IVF centers, that is why, there are so many IVF centers these days because many of these women are needing our ART services. Then even if you kind of become pregnant and you are working, then you have your issues with pregnancy also. You're not able to look after yourself. Sometimes you are not able to keep up with your antenatal or prenatal care visits. So, and sometimes you don't eat on time, you don't take your vitamins properly. So the issues during pregnancy also always remain because not only because you are older in age, so you have more preeclampsia, more hypertension, more diabetes or other diseases in pregnancy. You are also equally exposed to the nutritional deficiencies. You can have anemia, you have calcium deficiencies, you have vitamin D these days. Yeah.
When the age for the having the first baby is delayed because of being working, there are greater incidences of congenital anomalies.
Yes, absolutely. And
we need to go for further tests and evaluate ourselves.
yeah, absolutely. That's a part of the prenatal care examination these days, aneuploidy screening, which is done for every woman. Yes, of course, you have that issues. Yes, you have those issues.
We are seeing a lot of children with autism and these attention deficit.
Yes.
Again, that again adds to the stress factor in the working women's life. When you have a special child in your hand,
Yes.
by some means or other, in that case, it again adds to the entire.
It's like adding more stress. Now you have to take care of such a child. Right? So the other issues are related to contraception. Also, sometimes this is one issue which I wanted to bring about. That a lot of working women think that emergency contraception is something which is okay, but you have to go in for a regular method of contraception, and that issue still remains. And then otherwise you have some abortion-related problems.
That's very genuine. A regular method of contraception
And-
that suits your body profile is very relevant for
Yeah.
any lady.
Otherwise, you have those abortion-related complications. Also, And then, of course, there are issues with your menstrual health, you can say, abnormalities of menstruation. In this age group only, which is a reproductive age group, you have issues of, say, heavy menstrual bleeding, you have fibroids, you have endometriosis. So all of these can not only lead to your deficiencies and anemia, and they can decrease your physical as well as mental capacity to work. You can have more absence from your work. So it's a vicious circle. Unless you really deal with them early on, you can also, this can also affect your working at your in your professional life and your personal life. So you will kind of not be doing justice to either of this. So just catch hold of this. Yes, yes. So you must catch these things early. Do not ignore them. Go to a doctor or have yearly checkups. Or if you have any symptom, then go there. Don't ignore these things. And then, of course, if you go a little older, then you have start having your perimenopausal things and your bone health, your heart, then cancers like breast cancer, CA cervix, and nowadays endometrial cancers, etc. So there are so many issues that working women would be dealing as far as physical health is concerned. Next is your workplace. Workplace, there, as you've already said. Yeah. So then there are issues with your mental health, psychological health. So there are all issues which are very, very pertinent to, I think, working women.
Thank you.
Yeah.
Thank you, ma'am. We'll come back again to elaborate more on this. Since most of the common complaints among reproductive age women approaching you for consultation you have covered, we'll move on to the next question, that is about, ma'am, Dr. Nisha would like to know, these days, our adolescent girls, they are facing this common problem of PCOD. They are suffering from these, because of the lifestyle changes in the adolescent age group affecting them. We are having very common complaint among when we examine the school health. We do these school health examination where the girls come with menstrual menarche and the menstrual problems.
Yes, you are right, Dr. Tipti. PCOD is like an epidemic now.
Actually, it is epidemic.
Yes, and it is, out of the 10 adolescents who are visiting for different problems in our clinics, probably, 7 to 8 are visiting on account of PCOD. And PCOD, why it has become rampant, we all know it is because of the, lifestyle which the kids have nowadays, adolescents have nowadays. They are all the time stuck to social media, no much physical exercise, and there is abundance of fast foods. So they consume a lot of carbs and fats, but the diet is really, lacking in the actual nutrients which are required.
The childhood obesity is
Yes,
contributing to
yes.
PCOD.
Inactive lifestyle and nutritional, disorders. The imbalance in the nutrition, that is basically the reason. PCOD per se is not a disease. It manifests, when there is weight gain. Most of the times, the manifestations, they start coming up because of the lifestyle disorders, because of the disordered lifestyle, bad diet, no exercise. So this is what is rampant. And then what happens is that, once they start gaining weight, it is a vicious circle. Weight gain leads to hormonal imbalance, and that hormonal imbalance further leads to weight gain and excess of androgens in the body, which leads to cosmetic concerns like, hirsutism, acne. So all those problems are very common in adolescents nowadays.
What we understand is sedentary lifestyle because of the imbalance between the physical activity and the intake of diet. The type of diet
Yes.
rich in macronutrients, less in micronutrients.
Exactly.
Is pushing the body towards the hormonal imbalance.
Yeah.
And that is affecting the reproductive system of the girl.
Yeah, hormonal milieu, I would say.
PCOD, which is again
Yeah.
a syndrome.
Yeah.
As you have mentioned, hirsutism, acne.
Yeah, and it has got very many, manifestations later on also. It's not only about adolescents. Once PCOD sets in, it can reflect later on the fertility of the patient. Then pregnant patients who have had PCOD are more prone for gestational diabetes,
I
hypertension,
think
all
it's
those problems.
It's a cycle of things.
It's a
like
cycle, and later in
hypothyroid
life, you know, they are more prone again for diabetes, hypertension, CAD. So it's basically a lifestyle disorder which is rampant nowadays, and you know, we all are looking at, you know, educating our adolescents whenever we are going to schools and all.
Very true.
Yeah.
The hormonal balance is like.
I think we need to understand that what, as a parent or as ourselves, what food we are taking or what food we are giving to our children
Exactly.
needs to be full of nutrition, and
Yeah.
it should have less fatty, and these fast foods should be avoided.
Exactly.
as
That's a
much
problem
as
with
possible.
working women, because you are all the
I
time
think
out,
that's
so your
very-
kids are free to eat whatever, you know, they want to. Sometimes you may not have time to cook good food, you know.
By the time you come back, you also have a less
Drained.
to fight with them. Okay, do this.
Exactly.
Don't do
And I
this.
think you must engage your daughters into some outdoor activity. Force them to take up some
Exactly.
activity, some games, send them out, let them play.
A very genuine advice.
Yeah,
Very
that's
true,
very
very
important
true.
because all the time, as you said, they're stuck to the social media. So put them in some kind of physical activity, games and outdoor activities. So that just
And on the contrary, most of the people, you know, and their parents and adolescents, they are just coming with that ultrasound report which says PCOD. They are more worried about the structure of the ovary. And it takes a lot of effort to explain to them that it is not the ovarian structure which is worrying us. It is the manifestation of PCOD which is worrying you. PCOD per se, the ultrasound picture is not a disease. Till the time you have optimum weight and you don't manifest PCOD, practically you can have a normal life, you know. So we need to make them understand that it is not the ultrasound derangement which is worrying us. It is the manifestation of PCOD triggered by a faulty lifestyle, which is, you know, which needs to take attention from parents, from kids, and from all the health workers who are looking after them.
education and all.
Yeah.
The psychosocial health of the girl child is affected during the entire lifestyle,
Yes.
life course.
Thank you. Now, I would like to speak, I request Dr. Walia, Minu Walia, ma'am, to tell us more about what are the ways of screening for common cancers in women, ma'am. Breast, cervix, uterus.
So before I begin, I will take this opportunity to thank Dr. Kamla and the organizing team. And I'll like to, before I answer this question, I'll like to take the lead from both my previous esteemed speakers, Dr. Nisha Kapoor and Professor Guleria. What exactly they were saying is, like in our medical terms, in oncology world nowadays we use the term, sitting is the new smoking. There was a time when everything, every cancer you can think of, you will just close your eyes and you will have just one reason, tobacco, tobacco, tobacco in any form. But in today's world, I'll say all the non-communicable diseases, including cancers, we say the new smoking is sitting. This is the sedentary lifestyle. And if I may ask all of you, whosoever is in the audience, who is the culprit? So I think the major culprit is, including myself, we the working women. You know? Gone are the days when I would be happy by being a simple housewife or a homemaker. We are all to be, in a way, we are all party to it. I will not deny that wherever we meet other fellow colleagues and fellow women, and the first question we ask is, what are you doing? And naturally the person who is a simple homemaker starts to feel out of place or something, whatever it is, but that is the fact of today's world. And we as, not only that we are working, I see no reason for that. There's no other way out. But in a way to prove ourselves better than our counterparts, in efforts to prove that we are probably more competent or more equally competent, and juggling between home and, as everybody was saying, home and workplace, the result comes is I will want my child to be packed with something like a fast food. He is also happy and I am also happy. How much time I give attention to what is being cooked in the house. I am also happy with these ready-made meals, these preservatives that are being used. And plus, I feel in a larger aspect, the government and everybody is involved. Are we really thinking that even at the workplace, I mean, in the corporate world today, in the Western world, there are gyms in the workplace. There are half an hour breaks where people take time out and at least do some kind of a physical activity. But all we are juggling behind is running to the office, preparing meals, sitting at our desk, doing something, and then running back home, and then to give solace to ourselves, pack something, चलो आज पिज़्ज़ा खाते हैं, बच्चों को भी खुश कर दिया, and weekend, I also want to rest because I am tired, we will go out, but that's the way life is. And the return is all these things, including PCOD, these lifestyle diseases, and cancer is nothing apart from that. The fact that we are seeing so many cancers, the fact is only because it is all lifestyle related. And especially another thing which I wanted to tell is somehow there's something in our genetic makeup. In Indian women, whatever cancer happens in the Western world, we see it a decade earlier. So in the Western world, you see most of the breast cancers 50 and plus. But many of our patients in today's date is 30 plus. It is not a new thing that is happening. In the late 30s, early 30s also. Today morning only I received a call. This is a 29-year-old young girl with a very advanced cancer. So cancers are also, probably it is, I say, it is something that we are paying for this, the development that is happening at such a rapid pace, and we don't know how to accommodate to it. So coming back to your question, ma'am, yes, there are certain things we can still do to pick up cancer early, and that is what is screening. Fortunately, there are established screening methods for breast and cervical cancer. So these are the two cancers which are the commonest. So cervical has been the commonest all these years, and today in metros it is the breast which is number one. All over the world rather, breast is number one, and you will be surprised to know that breast is number one cancer, putting both men and women together. So you can understand the girth of the problem. A cancer which majorly happens in 50% of the population, when it becomes number one, putting both men and women together, how much is the magnitude of the problem? Fortunately, it is one cancer which can be picked up early, even at stage 0. And things as simple as, which does not take too much of time or too much of finances, something like breast self-examination. A monthly breast self-examination which every woman should do after the age of 20 at the end of her periods, which just takes 3 minutes. It will help you know your breast better. It will help you pick up an abnormality, pick up a lump which was not there. And since we know that most of the breast cancers in 90% of the cases are picked up by the women themselves. So better than it is being picked up as an accidental finding when the growth is already enlarged, it is better that we do regular screening, a monthly breast self-examination, and pick up this cancer when it is much more earlier in the disease course. Second is the clinical breast examination. Once you are 30 and above, to be done every 3 years. That should be done by any healthcare provider, whether it is your gynecologist, it is your physician, it need not be an oncologist. Any healthcare provider, your first healthcare provider, doing a physical clinical examination once every 3 years, that is 30 and above. And last but not the least, the thing which has actually made a difference is mammography. 40 and above, every woman should go for an annual mammography. And once 3 annual mammographies are negative, then the frequency can be decreased to once every 2 years. So again, to put it further, we are all educated women. We are all fortunate to be in a metro, in a one of where health facilities are not limited. Can I ask how many of us have got an annual mammography done? Can we have by show of raise of hands? So that is
ongoing mammography camp running in our center as of now. Dr. Walia here, I'd like you to mention that we should not skip out even during the self-breast examination also the axilla part of the breast, because there are the hidden pockets where lump would be there.
A very relevant point. So breast examination is not limited to the breast alone, and I always say the 3 sanctuary sites. The sanctuary sites which are often missed, one is the axilla, as ma'am pointed out. The second is just below the nipple, the areola. We palpate the entire breast and forget just below the nipple. And the third is the inframammary crease. So the cancers there in the inframammary crease just happen to be within the fold are also sometimes missed. So these are the 3 sanctuary sites which should never be missed. So coming back to the screening of breast cancer, only these three things: breast self-examination 20 and above, clinical breast examination 30 and above, mammography, annual mammography 40 and above. It goes a very, very long way to pick up breast cancer early. Then another very important cancer, cervical cancer, for which we have vaccination also today. But again, another very important point, if you are vaccinated does not mean that you have to skip your screening. Screening for cervical cancer should also continue. And for cervical cancer screening also, very simple test, 20 and above, 21 and above, a pap smear done every 3 years. 30 and above, we can either get a pap smear done every 3 years or a pap plus HPV co-testing, that is the thing nowadays, which can be done every 5 years. 65 and above, we generally do not recommend screening because we know that cervical cancers have a very, very long lag period. So but if all the previous examinations tests were normal, then 65 and above we can actually stop screening. So these 2 cancers, we have real screening programs, and there is scientific evidence that shows that mortality, it makes a difference in the mortality. It actually makes a difference in the screen detected cancers. The survival rates are much higher. Madam also asked about, I could see on the screen, endometrial and ovarian cancer. Unfortunately, there are no proven screening methods for the normal population of endometrial and ovarian cancer. But yes, in a high-risk patient, a typical obese lady with a history of diabetes, hypertension, metabolic syndrome, family history of cancer, endometrial cancer can also be screened, but it is only for high-risk population by, no guidelines exist for this, by routine ultrasound, which is a part of the normal health screening that we say in 40 and above everybody should do. And no hormonal test that we recommend for screening of endometrial cancer.
Cases need to be evaluated by the ultrasonography and other methodologies.
So again, I'll say there are no recommendations for it, but they can be evaluated by ultrasound because ultrasound will help in just telling the other things also. No? The annual screening we say for a normal health checkup. So 40 and above, probably an annual X-ray ultrasound which we recommend.
TVS should help out.
TVS will definitely help better for endometrial and even for ovarian. So ovarian also, no screening method for a normal population, but for a high-risk population, some of the agencies do recommend getting an yearly ultrasound or a TVS with a CA125 or using these indices like RMI, ROMA, and HE4 is something also available. But that is only limited to the high-risk population, no general acceptable screening methods for the normal risk population that we have. But fortunately, we know that the most common cancers in women cancers, the threat is of cervical and breast cancer, and they can easily be screened and they can easily be detected early.
Next question is actually pertaining to when we have spoken about cervical cancer in our Indian women. Maybe know from you about the cervical cancer vaccine available and what is the right age group and up to when would it be helpful, and how, what are the stats which tells us it is really preventable?
So today, fortunately, we have vaccination for cervical cancer, rather the only cancer for which vaccination is available, because this is probably one of those cancers where we know it is caused by human papilloma virus. So there is a viral etiology, one could develop a vaccination, but the right age for getting this vaccination is actually before the onset of sexual activity. What is recommended is 9-year onwards. So young girls more than 9 years of age, 9 to 26 is the recommended age group. And if you get the vaccination done from 9 to 15 years of age, then only probably 2 doses is enough. But after 15 and above, then it is the 3 dosage of the vaccines that is which is recommended to give adequate immunity. The basic idea that we should know is cervical cancer, more than 95% of cervical cancer occurs because of human papilloma virus. And human papilloma virus, how does one acquire? One acquires human papilloma virus through sexual intercourse. So once it is the onset of sexual activity, you will probably be exposed to human papilloma virus, and once you are already exposed to human papilloma virus, the vaccine is not going to give you any protection. So as far as, these are the guidelines for the Western world. In our country also we follow the same guidelines. But if the question is like somebody who is 30 years age, still not married, will the vaccination is going to help? Then the answer will be definitely yes. Even somebody who is 40 or 45 years of age and married also, will the vaccination will help? We do not know the answer. It is found safe. It has been found safe till 45 years of age if somebody wants to go ahead and get the vaccination done. But how much will be the protection once you are already sexually active? The answer is not there. But all said and done, even when we say that if somebody has got vaccinated at the right age, one should not do away with the normal screening methods. Pap smears should still continue 21 and above. The normal screening methods should continue. So right now we have 3 vaccines which are available. Now we have the nanovalent also, which is very recent addition. Otherwise we had 2. We had Gardasil and Cervarix. Now Gardasil 9 is also available, and it is 3 dosage of each which is recommended if you are 15 and above, if the girl is 15 and above, and it is recommended within a span of 6 months. Another very important point which most people don't know is that it is not only protects against cervical cancer. Why we promote cervical cancer? Because it is the most, it's a problem that it is a very frequent problem. But it also protects against so many other cancers also. It protects against vulvar cancer, vaginal warts. It also protects the boys, the young boys, against some of the oropharyngeal cancers and penile cancers.
Okay,
but the focus in today's world in our country is mainly for the young girls, because cervical cancer is the most prominent problem that we are dealing with.
A very
Thank you,
genuine piece
doctor.
of, yeah.
Can I add a point here that, now we are having an Indian vaccine which is coming in, and because cost factor used to be the one, it was not being included in the national immunization program. Till now we only had Gardasil and Cervarix, and the cost is 2.5 to 3,000 per dose. Right now Bharat Serum Institute has already launched its vaccine. Sarvavac is the name, and it is going to come at a cost of about 600 to 800 rupees. So probably Government of India is going to, include it in the national immunization program very soon. And we are looking at, studies which say that even 1 dose, if it reaches, if the girl is receiving even 1 dose, the protection is almost as good as 2 doses. So, the government is looking at vaccinating all the girls with 1 dose at least, once the Indian vaccine becomes available. So we have a positive thing coming in. I think we are. It is definitely going to be a game changer for Indian scenario.
Very true. I think it's going to reach the poor population.
By the end of the year, we are hoping that it is going to be,
That's wonderful,
available.
ma'am. I think it will be included in the. Pardon?
You have Cervavac already? The other vaccines are available. They are available. Okay. Okay.
That's a great thing.
Okay.
Ma'am, now Dr. Nisha, I would also like to ask you regarding osteoporosis, which we are seeing in women, even the premenopausal women. Many of them, they come with backache and all. When we test them, we see their bone mineral density is all, scans are all showing osteopenia, or even, they are in the osteoporosis. So
Yes.
could you please throw some light
Yeah.
on this?
Actually, bone health is one thing which we all very severely ignore. The reasons are that, the symptoms of osteopenia and osteoporosis are very subtle. Osteoporosis doesn't speak for itself. Till the time, somebody has a minor fall in the washroom and had a fracture of the wrist or the hip. So it is known to be a silent thief, silent thief which steals your bone without you coming to know of it. And the symptoms may be very vague, especially, when you have osteopenia. Osteoporosis practically, will not have much of symptoms except for the fragility of bones leading to fractures on minor falls. And care of the bones doesn't start after you've had osteoporosis. That is what is to be impressed upon. We all should know that the maximum bone density is gained by 30 to 35 years of age. That is the peak bone density. After that, bone loss is more prominent as compared to gaining bone. So we are, of course, physical exercise is one thing which we must inculcate as part of lifestyle in our children, that they must do regular exercise and a nutrition which is good in calcium, as well as, plenty of sunshine, leading to adequate amount of intake of vitamin D. Vitamin D mainly comes from sunshine. So, of course, osteoporosis, nowadays is like rampant. It's a rampant problem. You get bone mineral density done in women. Most of them are osteopenic, postmenopausal. The incidence is as high as 70 to 100% in Indian women after menopause. And the morbidity of the old age mainly comes from fractures. Once you have had a hip fracture, possibly, might be, writing like a death sentence. Except for thanks to the surgeries which have now come, and we are getting better prognosis for hip fractures. So osteoporosis is something which we need to look at from prevention point of view besides the treatment, and the prevention has to start in the childhood, looking at the diet part, good in calcium, vitamin D, good sunshine exposure, and regular exercise. If you don't exercise your bones and you are having a sedentary lifestyle, the muscles are going to be weakened, the bones are going to thin out. So exercise is the most important part, and of course screening in menopausal, around the age of menopause, that is very important. People who have had early menopause or premature menopause, they are more likely than people on certain kind of drugs like steroids and PPIs, which are very common for so many diseases nowadays, even thyroxine.
I think PPIs, Pantodac and all these antacid medicines are popped in. I think
They are
one of the
often
positive
they are
factors, yeah.
available over the counter.
Over the counter,
And
people take
if
it.
I ask anybody, or people sitting here, possibly more than 50% of them, they take PPI 3 to 4 times in a week. That is the incidence of intake
Exactly.
of PPI, and then CKDs and
And
CLDs, all these
that's a proxy
diseases.
indicator of the stress in your life, because acidity seems to be because of the stress, mental health
interlinked.
issues, they are interlinked.
And vitamin D deficiency is like epidemic nowadays. You check your
Indians.
vitamin D and it is almost, the incidence is 90 to 100% of vitamin D deficiency.
Dr.
Because
Kapoor?
most of us stay indoor
Yeah.
all the time. We hardly have any sunshine. And then the pollution doesn't let the good rays come to your skin.
Very true.
So
Dr.
even
Kapoor,
if you are
from here
sitting in
only-
sun, you may not still be synthesizing vitamin D, as you are in a very polluted environment.
Dr. Kapoor, you have already opened up the chapter of the deficiencies, basically nutritional deficiencies, by speaking about the vitamin D deficiency, which is so again rampant, again an epidemic in today's world. We'll like Dr. Kiran to ponder a little more over the nutritional deficiency, the common nutritional deficiencies which our working women faces, or in general we can say the female gender is exposed to during the lifetime course.
So I think one of the most important deficiencies that women are experiencing is iron deficiency.
Right.
So if you look at our statistics, even today, more than 50% of our women are anemic, and you will be surprised to know that about, say, 20 years back also we had the same incidence. So we somehow have not made any kind of improvement as far as anemia is concerned in women. So we really need to look at this problem.
I think that's very sad, ma'am, because
Yeah.
I think.
So that is
women-
why, there are a lot of programs which are coming not only by Government of India, Anemia Mukt Bharat. There are all our associations, national associations, they are looking at the ways, the reasons for why we are not becoming better, but also how to deal with this. And I think apart from the faulty food habits, then worm infestations, then
We need to find the gap. Despite
Yes.
the educational and the financial empowerment of today's female gender, despite that, they are still facing these nutritional deficiencies.
So nutritional
Meaning to say they are not
education
able to
is
take-
also very, very important. So what I want to stress here is for all the working women is please take your health on priority. We are not the ones who are to eat the leftovers. We actually should first feed ourselves, make our deficiencies correct, fulfill our stores. Then I think we will be able to look after our family members and
Will
others
be a better pivot of our family
Yes, if
once
want.
we are able to
So I think this
look
is very
after ourselves.
important that we as women, as working women should take priority on that. Please, जैसे हम कहते हैं ना कि अपने stores भरोगे then only you will be able to distribute.
हाँ
to
वो
others.
होता है
So
ना
do that.
फ्लाइट में पहले ऑक्सीजन का मास्क खुद लगाना है फिर दूसरों
So
को
that
हेल्प
is a
करना
very
है as
important
simple as
carry
that.
home point from here. Please do that. And as far as the various other, I think I will not go too much into the iron therapies and how we can make anemia treatment better by there are better modalities. They are looking at how to distribute iron, how to give iron, how to make it more effective once. And then we have some better iron preparation, parenteral iron. So there are a lot of things which we are working on. But side by side with anemia, you also look at B12 now. Look at folic acid, look at vitamin D, which Dr.
Contributing
Nisha
to
has already.
anemia of different order actually.
So a very balanced diet for women. More of say milk and milk products, proteins. We have to think of those.
So basic
adding
social
those.
science lessons. That balanced diet makes makes your body strong. So you have to have diverse food. With each type of food should be in your plate at any point of time. You have to fractionate it in such a manner that you have a proper lifestyle balance along with
Yes.
your food balance and
So I
exercise
think it's very
balance.
important for all of us to be like dietitians. Whenever you get a chance to meet a dietitian, ask her all the questions. Being a doctor, MBBS doesn't mean that I know everything about diet and what is my recommended diet. But I think all of us, when we are at home, we should really look after the diet which our family and we are having. This is very important to. First is to have, just to keep your deficiencies away. But then there are certain periods in your life when you will need to take iron, for example, pregnancy and postpartum period, your breastfeeding. So there, in women's life, there are periods when you will need to take supplements, irrespective of your diet. So the same is like when you're adolescent, when you are pregnant, when you're postpartum, when you're breastfeeding, and then you're perimenopausal and postmenopausal. When you all of us should take some supplements. That is important.
Ma'am, I would also like to ask you, what are the tests which needs to be included in preventive health checkups? We do the basic screening tests. Do you think there are some tests which are specifically important in different age groups?
So we always say the annual health checkup for women. Yeah.
And we will like all of you to please contribute to this question because we should know the spectrum of different tests we should undergo as a lady, as a working lady, so that we keep our work-life balance in a proper manner.
And we know this is a thing of priority and one needs to get this done.
So I think all the basic blood tests, which especially looking for your CBCs, LFT, KFTs, and especially your diabetes, for sugars or glycosylated, then you must have your basic routine urine examinations. Then as far as the screening for thyroid is concerned, that is also important. And then, cancer screening, I would keep it like, as she has already said, if you not screened yourself, get yourself screened for CS cervix or breast, depending upon your age and your risk factors. You can go in for other colorectal or for even ovarian, depending on your risk factors. So you do that. Besides that, have your checkups for blood pressure, for your weight. So maintaining your weight, maintaining your blood pressure, blood sugars, this is very important. So I think I would be okay with that unless you have some other risk factors. So people otherwise in a corporate health checklist, you have a big list which would be, so you also have your cardiovascular health to look at, you have your bone health to look at. These are the two more important aspects.
I think
which
these
you
are
should,
also very important, ma'am.
Yeah, cardiovascular and the bone health related. This is very important. So I think anything, yeah.
Yeah, think vitamin D as well as B12, if we check it, B12, it is also again very common deficiency because most of us are vegetarians. And iron deficiencies again because most of us are vegetarians, no? Even if we are non-vegetarians, we don't consume it every day. We'll consume it once or twice in a week, which is not enough to really give you the daily requirements. And then menstrual problems are so very common in women. And excessive flow during periods is one of the important reasons for women getting anemic and not paying attention to that. So this is one aspect of anemia which also the women must look after. If there is a change in the pattern of your periods, you must always look at the reasons. Could be very simple and they could be very complicated. So never ever ignore a change in the menstrual pattern from your baseline. If it is excessive, must
Very
look at
important point.
the causes, underlying causes for heavy periods. That is one aspect. And then I would like to include mammography. Already ma'am has said that mammography must be included. Vitamin D deficiency also should be looked at. So
Now,
these-
ma'am, for mammography, I just wanted to ask you, do you think mammography after 40 needs to be done yearly or till 45, once in 3 years will do or once in 2 years will do?
There are standard guidelines for that you do it yearly after 40, and if it is 3 consecutive negatives, then you do it every 3 years,
3 years.
every 2 years.
Every-
Every 2 years. But if somebody has got a family history of
Family
breast
history,
cancer,
then becomes-
then you should continue with the screening every year, right?
And there's another thing, if you are, like nowadays, the people are really aware, we have a lot of tests also. So there are people from BRCA mutated families. So strong family history, but they also know that they are BRCA mutated. There is a history of BRCA mutation running in the family. So these high risk individuals should not depend on mammography. What is recommended is MRI of the breast as a screening modality. Because one is you want to reduce the exposure to radiation. Second is MRI is much more sensitive than mammography.
Very true.
So BRCA mutated, MRI is the way we do screening for these patients.
Thank you. We'll take the questions in the last. Just after a few more questions, we'll take the questions.
We'll take, we have, till now we have spoken about
few more
the
questions.
physical
Dr. Jaya,
health and the
yes.
nutritional
So we are going
health.
towards the mental health.
Let's go towards the
So
a
Dr.
very relevant and very important aspect, that is the mental health.
Thank you, Dr. Kamla.
Yeah, actually,
I
the
was
genesis is
coming
there.
to it.
So we'll move on to Dr. Jaya and we'll like you to please tell us about the common mental health issues in a working lady.
I think, first of all, thank you everyone, and finally good to be here. Few points which I would like to add on in the previous questions, as I did not interrupt during that time. Let's go backwards if you're talking about screenings. Women lead a very high stress driven life. We suffer anxiety, and when we look at the clinical stress models, we never lose our functionality. So women will be fully functional. You will be cooking for yourself, you'll be taking care of the family, but yet you could be housing a stress disorder. Mostly it'll come up as random body aches, you've had some medicine, you're feeling fine, but it's repeating. Migraines, psychosomatic illnesses are something that are often, looped out of your general health, and it's just seen as something that's happening once in a while, and you don't see a pattern that exists in your life. So it's important to understand that when we talk about psychological health, we're not talking about your intellectual health. So you could be fully functioning, you could be a really intelligent person, yet due to emotional component of your brain, your physical body could be suffering. There are several cases that come with fibromyalgia, with sleep disorders, that are rooted in psychological distress or are deep-rooted in prolonged depression. One of the best ways to see, how much stress is affecting you is not to look at the level of impairment. As a woman, you will not be impaired till you're absolutely downright, chronically depressed. But one way to screen it is also to check your cortisol levels. A serum cortisol level at 8 a.m. and 5 p.m. is something that gives an indication of how much stress is taking a toll on your body. The second way to see if you are having some or the other kind of psychological distress is to see a pattern of illnesses that is present, especially related to migraines, pains. In perimenopausal syndrome, we see a lot of insomnia, a lot of negative dreaming that is coming along. So these are the kind of things that you need to be focused on. Apart from that, if I were to talk about the common illnesses of working women, I think all of us are suffering with some or the other form of common illness. One is anxiety. When we talk about anxiety, it's not that anxiety is something that is abnormal. Sometimes, or sadness, let's say, or being depressed. Sometimes there is situation-specific appropriateness to an emotion, but it should not cause an impairment. So for example, if I was the one who's getting anxious, to speak, it's normal. But if I start palpitating, I fall off the stage, I run away, that is where anxiety comes into the picture. A lot of times, what we do with children is that we invalidate how they feel. That we tell them that, oh, you don't have to be sad, or you should not feel anxious, you have everything. And that is the onset of psychological distress, where one feels that their emotions are not validated.
So basically, expression is the key.
Absolutely.
One should express.
Absolutely. And the one
I
point,
think as parents, as she's stressing that we should not underestimate our, the problem of our children. Just don't wave it off that, you are kids, you have everything.
Absolutely.
And, you couldn't be suffering from all this. On the other hand, mental health now is supposed to affect physical health in so many ways. So many diseases, they are because of, ill mental health.
Neurohormones.
So never ever underestimate the problems of your own self.
Absolutely.
And any of your family members. Rather, as doctors, we should be guiding them. That go to a person like Dr. Jaya, seek a counseling. And so many times it is just the counseling session and the therapies which work, and you don't need to even take medicine.
Speaking to a third person matters a lot. It is speaking
absolute.
out. Is
See,
what we want.
It's very important that you accept their feelings.
Absolutely.
Whenever your children come to you with some problem and you feel that child is stressed, first is you have to accept
Absolutely.
that she is stressed, she has feelings, and we have to empathize with them. It's very important.
Absolutely,
to have-
absolutely.
Then
And-
you work on this.
And then what happens that in the long run is that we have to think of strategies that will help us prevent with these disorders. See, physical disorders are usually given more emphasis, and mental health disorders are not given emphasis because there is a social taboo कि हम कोई पागल थोड़ी हैं या हमारा बच्चा कोई पागल थोड़ी
it's
है.
very important.
But we often forget that these stress-related hormonal and emotional changes will contribute to physical disorders later. One point from the previous questions that I would like to add on to is that everybody is talking about sedentary lifestyles, and I completely agree that we have to change the sedentary lifestyles that we are living. And sports, especially girls, should be involved in sports because sports is the only thing that helps build confidence. And if I were to talk about boys, it is the only thing in life that teaches you how to lose. And that is where emotional resilience increases. So we were talking about more and more resilience and emotional levels. This is something that we really need to focus. Stress, simple answer, stress, anxiety, depression, personality disorders are the ones, or the emotional regulation disorders, which are more common in working women as compared to non-working women. So that's...
Give some suggestions to maintain work-life balance.
One suggestion, especially for the women, there are a couple of points here. That one is that don't feel guilty for maybe not doing housework, or maybe doing too much office work, or for not doing office work. Most of us only taken off on the day where we have some other work. We'll not go to the office because we have some other work. When was the last time I think any of us took an off to not do anything? Because there's so much guilt that is associated.
Guilty,
That is the guilt that you have to disengage from.
Sabbatical is actually expensive. Either you're doing
It
something
doesn't.
or either you're doing other things.
No, don't think of the extreme sabbatical. Just one day off. Just 2 hours off in a week. Think of micro implementable solutions that are possible in your practical life. First is that. Second, work-life balance is that create an understanding of how much you want your personal life to affect your professional life, or how much of your professional life should affect your personal life. That is a boundary that you have to draw. Everybody says most commonly that, oh, don't share your work at home, or don't share your work-related stress at home. Please share your work-related stress at home. Share it with your spouse, share it with your kids, share it with your friends, so that you have an opportunity to vent out. And sometimes people are just listening and they'll give you some random solution that can be extremely helpful. And it also helps bonding and making the relationships better. So on and so forth, it will help you in making or becoming more.
To attend you even after you're home. And if you're discussing your hospital problems at home, the life will become a wreck.
Dr. Jaya, I derive from your,
I think she is saying that if you are having...
Yeah. I'm just joking that if you are professionals like doctors, you are into a very high stress situations. You just want, to be left alone, and you want a quiet time for yourself and to, pamper some of your hobbies, which is a good idea, I think. Just watch TV, read something, and de-stress yourself by gossiping, making some phone calls to your favorites. So these are some of the things.
What I realized, detox is on a daily basis. Detox should be daily basis, not at a once in a while.
Yeah.
We should learn to do nothing. Most of us, especially women, we don't have the capacity to do nothing. We don't know how to sit idle. And that is a skill that we need to learn. That we need to unlearn 15 minutes a day, but developing that habit.
Basically, you highlighting full time.
Yes,
Okay, and that for a daily note.
absolutely.
That's
You Jaya, I just looked at some algorithm. Somebody has made an algorithm for working women. So there are 24 hours, 8 hours to sleep, or 8 hours for work, 7 hours for sleep, and I think then you are left with 9 hours, which have been divided into 3 hours each. 3H, that is kind of home, and there are 3 Fs for family, for faith, and for something else, friends. And then there are 3 S, mind, soul, and something. So I don't know how you can do that, like you make your time like that, but if you try to put in all these things, in you have a kind of wanting, as you said, do not mix your hospital and home. Try to forget about home in your hospital and your hospital in your home, unless you really have a issue about some patient which you want to really discuss and find a solution to that. Otherwise, we can have little demarcation in our hospital. And then another thing which as a woman and as a person who's running the house also I feel is delegate duties. It's not my duty that I should be doing cooking also, I should be getting the stuff from market, I should be paying the bills, and delegate duties. Teach your children to do their own work, they should be doing their, why not they should be, division of labor at home is very important. And
participation.
Yeah.
Friends, we somehow don't think to have
That one F is that friends, one alpha is friends.
men have the friendship for longer. So once we get married, we all found that all our
We should have girlfriends.
yeah, in this past they are different. Actually,
Very important.
friends with the husband's wives, friends' wives, and everything. So the best is always to have your own ladies friends, as ma'am pointed out. And those friendships are very, very rare. But now people are meeting in groups like Wow, Hopes and Women of Wonder. So small organizations also, because women also need women to talk. So I think that is very important.
I agree with that. In fact, ladies who are not working, They are using this friends concept, to make their lifestyle worse with kitties and, binge food, That is making the things worse, those partying. So friendship, it should be, you can have walk friends, no? कि चलो सैर करने के लिए आपने एक, you found a walk mate, you found a yoga mate, you found somebody who would be there accompanying you to the gym. So you can have healthy lifestyle, healthy habits to share with your friends, not just partying. That is again very important. And in hospital, if you have got a good corridor like you in NHPC, you have so much of sunshine and good lawns. So probably delegating a time for a walk in the afternoons. Even the institution should be looking at that there should be a break, for all employees to mingle with each other, socialize, and also do a walk simultaneously. So some kind of these things which don't need any expense on the part of any institution or any extra resources. We just need to change our thought process. The institutions just have to look at the practices which they are following.
Very true. To wind off, to conclude the panel discussion which has been so interactive, we are still waiting for the questions from the forum actually.
If anyone has any questions, please, you can ask.
I have one question. Yes, please. You're most welcome. And I will request for the male gender also to participate. It's not like giving a dominant arena which we are talking about.
So, very good discussion is going on. One question from Dr. Jaya, that why it is so that we women keep us in last term? Why? What is the psychological?
So this is what is known as social conditioning. Because of years of patriarchal rule and the conditions that we have, it's not only genetics that gets transferred, it's also learning behaviors and habits that gets transferred. So for example, I would say 1 or 2 generations above me, it's very difficult to move away from the patriarchal norm. Even though we have started working, even though we have started earning money, more money than our counterparts, in any case, our thought is still judgmental towards our own self. Women are sometimes the worst enemies of themselves, that because we are not able to break away from the thought, we feel obligated to follow the thought, or the definition of a good woman would have a lot of more burden as compared to a bad woman or for a rebel woman. So it's the social conditioning that has not been challenged as yet, that even today we would see, or we would feel a whole lot of guilt if we were not doing certain things that maybe our husbands or our counterparts are not doing. So disengaging from the social conditioning is something that is very important, but in a healthy way, not going into another extreme that can be harmful to the self as well. But to maintain a balance and to understand and prioritize our health is something that we need to practice. And to practice, we need to first learn it. That's the
I
answer.
think the culture is going to take a few decades to change. Still, if a child has to ask something for eating, they will go and ask their mom. They will never go and ask their father that I want to eat this thing, please cook it for me. The culture is going to, the Indian culture is going to take decades or maybe centuries to change. Women are supposed to look after the household. Somehow we are not able to detach from that duty, morally also, and also as per the expectations. We always want to come up to the expectations of the family and the kids. And Dr. Jaya is very right. And as also Dr. Kiran has said that, we ourselves are responsible to some extent. We have to change that culture ourselves. We have to delegate the duties, as she said. And as Dr. Jaya said, that we are going to be instrumental. We may feel that the family is retaliating that. There might be some retaliation from the family. But then it has to be in a very subtle manner. You have to make your family understand that once you are contributing as bread earner, they have to contribute as housemakers.
Very true, very true. I actually thank all the panelists.
So I'll just say one more thing, that it's not there in all parts of India. There are certain parts of India, for example, Northeast, for example, Kerala. So they are giving a lot of importance to the women's health, and they're very empowered. So it's not that we cannot change, it is more towards when you come towards north. And there is a very interesting incident that one of my colleague, doctor, and husband is also a doctor, she used to tell me that whenever there is suppose a brick of ice cream brought in the house, so her mother-in-law would say, let's make half, one half. So one half is for the boy, so rest of the half is for the rest of the family and girls and so this is the kind of tendency or our mental.
This is about the social conditioning.
So it's not that we cannot change, we can change. So change has to be brought by us. That is important.
We are looking for
It's
one
very
more question.
difficult to take out me time, especially for working women.
Very true.
Thank you.
Excuse me, ma'am. Sorry to interrupt you. Just wanted to know how rare it is to see the high bone marrow density, high bone mineral density in protein disease. Do you
It's, I think, jumping.
high BMDs?
I think
We hardly ever encounter high BMD.
I
Usually
think
low.
IBMD is associated with high risk of breast cancers also. Do you recommend anything for that? I don't think high BMD is APO plus 2. He is routinely seen at all.
I think there
No.
must be some
There has to be some metabolic
metabolic disorders.
Hyperparathyroidism.
Hyperparathyroidism and things like that.
Osteoarthritis and all, no.
No,
I don't
yes.
think, but I have come across few, so I just wanted to know. Like,
So
what's-
then that person needs to see some endocrinologist or something. There must
Maybe
be some
some athletes and all
Like
might be
para-
having a BMD or a high BMD, but in routine population we ever
Either it has
hardly ever
abnormal
heard
or
of
it
this
has-
entity. We hardly ever heard of this entity.
Maybe that person-
In clinical practice we don't come across.
Maybe the orthopedicians or endocrinologists know there are conditions like hyperparathyroidism when this kind of situation is there.
Chromosomal problem, that's why the person is getting
Before winding off, we'll have the last question for the session.
Thank you very much for wonderful
Okay,
session.
yeah.
Just I
Yeah, we
have
have
a very
a hand
silly
over.
question. Please don't laugh at me. We know that the human papilloma virus is transmitted sexually. So why boys are not vaccinated?
Yes.
Boys should also.
No, not in Indian scenario. It's not in
Tell
started.
you what, that is the best solution. But the thing is, the sufferer are women. So we have to protect our women. You know, that is very important. But it is not that they should not get it. It's the same thing where we should train
the
our boys to do household work, or we should train
so it is something
gender
like-
bias, you know, that kind of thing. Same thing.
So,
But it's
recently
not-
in Sikkim, we did that school vaccination for children. There also I questioned why boys are not being vaccinated. That should have been done equally.
I think
Yeah, that's true.
Primarily, that should have been done.
Yeah.
National
So
chapter
from the
will include
government's
That's a
point
very-
of from the government's point of view,
Ma'am, it is
the-
in Indian
the-
Academy of Pediatrics, it is in the guideline, the boys should also vaccinated with this thing.
Yeah.
And as
No, what I'm trying to say, from
Because
their
of the
point of
cost.
view, the incidence of penile cancer and anal cancers is much less than the incidence of cervical cancer.
No,
है ना?
ma'am, it's
So
okay.
totally agreed that boys should also be vaccinated, and she rightly pointed out in the Western countries it is
It
advocated
is
for boys
already
also.
there for boys between the age of 9 to 26 years in Western countries. In India, because we don't have so much availability, so the government's first target is to vaccinate the girls, but ultimately they are looking at vaccinating boys between the age of 9 to 26 years. Because warts are so common. I think you see warts every day in your clinic. It is so rampant nowadays. The kids are becoming sexually active at a very early age, and prevention of warts is such an important thing which we can do by giving this vaccine to boys as well as
So
girls.
another important thing is to help men to empower women. Let's have a question from you.
Because
Let's
it's
have
a
a
change. If we women only change, it won't work. Our counterparts should also change.
We are living in a society which has to be balanced one, and the contribution from all members is required. Yeah, please, maybe have a question from you.
No, the point is with Dr. Jaya ma'am, as she was saying, we as factory medical officers, we deal with employees of very poor socio-economic status, poor financial background, educational background. So they're not even aware about their own health or whatever the health issues can occur to them. The cancer and all is a big alien term to them. Poor people know, they don't even know about they're anemic, they have to check for anemia, nothing. So those people say they are the breadwinners of the family, they don't have any rest time and all, they are anemic, they have the risk factors for this cancer and things, but how do we approach them? Or how do we properly target them, since it will be a great help for us to...
So we will also see all through clinical research and studies that you will see that economically weaker section of the society is mostly emotionally more resilient. That is because of the attention and the cognitive impairments that they face less as compared to the economically stronger section. So when we talk about the mental health disorders, unless they're in a severely traumatic situation, their resilience and coping is much, much better than the economically stronger section. As compared to the nutritional deficiencies, I think it's not only one society, one poor person that we need to focus on. It's a systemic intervention that needs to change. Be it the organizations, be it the caretakers, be it the employers of such people or the government. It has to be consolidated effort to uplift the EWS and not just, one organization or one individual. And unless we start focusing very small interventions such as I don't know if you know or not, Saral and Lal Pathologies and all, they have started a home care assessment. It's a cheaper but more focused assessment that you can get for your household help. And then you can also start giving them, or you can make them visit the doctor. So if you know somebody who's a rickshaw puller, or if you know your household help who's not getting the right help, then I think it's more important to empathize and take control. If you are the one who can afford, just start there. Just help that one household help, and that's enough. That's all the systemic change that needs to come. And to make them aware.
I was coming to look after your maids who are working for you. Look after them. It's as a responsibility. It's our responsibility.
It's
people who are yes, people who are working with us, even at our workplace. So, people who are working, at least a small circle around you, you are able to help. Start from there. I think then it will percolate down.
Can we have the last question for the session? Yeah.
Actually, I have two.
Okay.
One is like HPV vaccination. How do we corporates can help Government of India to fasten the outreach to the communities? And what are the challenges in that? And
One of the important mechanism would be if the indigenous vaccine becomes a part of the national immunization schedule.
Okay.
So that will automatically increases the outreach, and that is going to be a very important, relevant step.
But for that we have to wait, no? But as of
No,
today,
I think they have already manufactured about 20 million doses, and first of it is not going to come to the market or to the pharmacies. First, government is going to take it over, and that is the plan. That they plan to vaccinate at least 50 million girls by the end of this year. Prime Minister Narendra Modi made this announcement when this vaccination was launched, that they are looking, in somehow got delayed because of pandemic. Actually, it would have come in the market 2 years ago, but then they were busy making the other vaccine. So now it is already launched, and it is about to come in the market, and at a very affordable price. That is, initially they were saying 200 to 400, but now I am reading in the news it is 600 to 800 rupees per dose.
So now the last question.
Yes, and corporates
can have camps.
Yeah, I think.
But can we go ahead with the available whatever pricing it is there through CSR fund?
Yeah, very true.
But I know it will be challenging because we were thinking of
people who can afford will anyways.
We were thinking of going to schools and creating first awareness camps, and then tie up with municipal corporations, and then
it still has to be little subsidized.
The economic component has to be taken.
no, corporate will bear the cost. Huh?
Yeah.
Why not?
And why not?
Then can we?
Why not?
And what are the
You can
challenges?
catch the
Why
young
not?
girls from schools. Yes, why not? From the public school, from the government school, you can.
It will come in the government program because nowadays measles vaccines this program is going on. So after few months, I think 2 or 3 months,
It is going to be included in the national immunization
because
program.
of the COVID, because there are so many papers published after COVID vaccination. So they are waiting for the side effect of COVID vaccination.
So once this program takes off, it a very good program. Vaccination has always been successful.
I think the target group which we are looking at 9 to 14 years, those are the kids who are visiting pediatricians. And I hardly ever see, talks on HPV vaccine in the pediatric congregations. I hardly ever see. Actually, it is the pediatrician and the general physician who has to be aware. The moment you talk about cancer prevention, everybody gets scared and goes away, Why we need cancer prevention in a woman, in a young girl of 9 to 14 years? That's a big taboo. You have to make them understand. Until the time pediatricians and the general physicians come into play to educate their patients, it is going to be very difficult.
I think this is one of the longest interactive session which has gone through in the entire conference, in this conference venue. So while concluding, I'd like to say, as women, whatever the social conditioning has been, whatever hormonal backup we are born with, we are predisposed for innumerous lifestyle diseases. But what is required to have is the optimum health, not only physical but also mental, and that too we have to take the responsibility of oneself. The self-care. The self-care is the utmost, it has to be given the utmost importance. Nowadays, awareness is not far off. Resources are not far off. It is just your involvement into it, be it a lady, be it a man. It is just your involvement and getting to know how this can affect and how you can live in harmony with yourself, with your own wishes and with your own roles which you have to play in different platforms. That is very important. So nothing is out of reach. Everything is actually on the finger button. Thank you so much for participating, and I thank you all my expert panelists being here and creating awareness on this.
So now we'll follow Dr. Jaya's guideline. Take one day off